Hi, I'm Karen Morgan. I'm a volunteer with AARP Maryland, and I'm here during Protect Week, which is our campaign to shine a spotlight on the scourge of elder financial abuse and other issues related to financial abuse as they target those of us who are older. Protect Week this year occurs from June 12th to June 16th. And this is another in our series of expert interviews to focus on different issues. This interview is focused on benefits and when people engage in fraud to harvest benefits from people. And we like to call this episode When Caring Hurts. And my expert guest today is Lynn McCamie. And she has been with AARP Maryland. She's partnered with AARP Maryland on a number of occasions. She is awesome at her work. She is committed. She has a bachelor's in social work from Hampton University and a master's in social work from Temple University. And she began her career in the aging arena with the Delaware County Department of Aging. And then she went to Texas. And now she's back in Maryland, and we need you here. So we are very glad that you came back. She has worked in administrative leadership. She's worked on fiscal oversight, health and wellness issues. She co-wrote a grant to fund a Baltimore County Elder Abuse Coalition, which is called BC Rest. And that is a major resource for those of us who are fighting the battle against elder financial abuse. She's been manager of the Ombudsman program for the Baltimore County Department of Aging since 2007. And that program has staff and volunteers who assist in providing advocacy and complaint resolution in licensed long-term care settings. So, Lynn, I don't know how you find time to actually, I don't know, BC Rest, but we are so happy to have you here today.
I am glad to be here. Thank you so much for allowing me to speak on such an important topic.
This is important. The scammers apparently are now engaging in human trafficking of older
Yes.
adults, which, what?
Yes.
What is that?
Yes. I'm so glad that you asked. I think that due to ageism and bias of older adults, many are perceived as having less abilities and, I guess, control over the things that they want to do, over their life, over involvement in their financial affairs, involvement in their identity. And those things put the residents or individuals at greater risk for exploitation and abuse. Because they rely so closely on their systems for support that sometimes the benefits and services that they're now receiving really get mixed up and not put to use for them. They are told to wait. They are told I have it, and I have it never really materializes for the things that they want to use. And all too often the older adult is scared or fearful or thinking that something won't be provided to them if they speak out. So we don't hear a lot about the human trafficking of older adults, which is more of their benefits and services that they might be receiving, not being given to them at a particular time.
Yeah, and I can imagine that if the person who's perpetrating the abuse is a family member or like a friend or a neighbor, that makes it even harder to report that because the victim feels like that their entire welfare is dependent on the goodwill of this criminal.
Absolutely. A lot of times we see this happening when maybe their food stamps are being withheld, Social Security benefits are not being honored and passed on to them, benefits for Medicaid and Medicare, or veterans benefits might be also withheld. We also see those things happening where it's a way that they're withholding care that might need to be given as a result because they're the caretaker. And if they don't have access to those things I just mentioned, then their care suffers. We also see that they become sometimes staff or employee in venues that now they're working unpaid, but they're there to do
Mhm.
daycare. They might be there to actually watch other older adults. They might be there to answer the phone, but not getting paid for that. And their benefits are being used in a way that they can't provide for independently. We've
Mhm.
also seen, unfortunately, that they might be coerced into participating in illegal activities that might involve drugs, money laundering, or even
Mhm.
maybe themselves not being coerced sexually, but being involved in sexual acts, opening their home to others, which are unfortunately engaging in levels of sexual interactions without their agreement. We know at times that the older adults have been threatened to comply and often hide what they might be providing when a law enforcement or an advocate comes in, that they misrepresent what might be happening.
That is just shocking, to me that people in such a vulnerable position can literally be just exploited like that. I mean, that is heartbreaking. I mean, people, and from what I understand from your information, they will abuse, these criminals will abuse power of attorney,
Yes.
threaten to, take all the money in the accounts, or guardianship rights, because you can have a guardianship of the person or guardianship
Hmm.
of the estate, of the finances. And it seems like maybe some of these people enter these fields with good intentions and then they become corrupted along the way.
Yeah, we've seen that happen as well. The thought is that they're providing a service much needed. They'll be in a supportive environment, but it doesn't really pan out for the individual to live an independent life. Their life is really dependent upon the direction that these abusers are taking. We've seen some of the abusers say things like, we're only keeping your money for safeguarding. We know you don't know how to handle a checkbook anymore, or you wouldn't know how to pay the bill. So we're going to manage that for you. Or there's so many people living in this setting. We're going to pool all of the benefits together and we'll really get things that everybody needs, but it may not be something that they want. They might
Mhm.
not even get a chance to appreciate what it is that was shared because it's all gone, or it
Mhm.
may never have come to them in the first place. Sometimes we see that the abusers know that when there is a outside support system, they say things to the older adult like, no one wants to visit you. And they do that as a matter of isolating them so the support system won't get a chance to
Ugh.
see, hey, something is wrong here. um, they may say things like, we'll call the doctor for you and go and pick up
Mhm.
prescriptions, and it's pain medicine that usually might have some kind of feel good feeling for an individual who's not experiencing that pain. And then the older adult has to continue living in pain because their medication never gets to them. And that
Mhm.
caregiver or that support system is doing other things, whether it's taking it personally or maybe selling it in order to keep earning cash, but the older adult never gets to benefit from that. And sometimes we also see that the individual may not have personal clothing or personal effects. They might be
Mm-hmm.
wearing things out of season, and that's because the money is not coming to them or their benefits are not coming to them. So they can have the nice things that you and I take for luxury to walk around, change our clothes, have sporting clothes, have going out clothes, have lounging clothes. They may have just one set. And when that's dirty or soiled, that might be it for a long time.
Yeah, and that I mean, and to do that is so cruel, but it seems as if these perpetrators, they're so focused, I guess, on what it is they want that they don't care about the cruelty, or they feel like the person deserves the cruelty because they're not being paid enough, or they're not getting enough of whatever things of value that they think they deserve, wrongfully, I might add. But that seems to be the mental process going on.
Yes, I can tell you in our world, in the Ombudsman Advocacy Program, we've seen this happen, unfortunately, in our assisted living settings where the provider will keep us from doing our visits because they know that they are doing a multitude of things by pooling the benefits of the individual, by trying to buy expensive items, but the older adults don't have the opportunity to take advantage of, those particular things. We've also seen where they don't really get to have the quality of life and go on outings because if they're out in the public, then that's a chance that they can reach out for help. So those support
Mm-hmm.
systems really keep them cut off from individuals. We had one lady in particular that was moved 3, 4 times from assisted livings throughout Baltimore County, and eventually, when we found her, she was in a city facility. So they went to great lengths to make sure that she
Oh,
wasn't approachable, that she wasn't available. And every time we would talk to her on the phone, the provider was standing right over her, so she couldn't give us any
oh,
insight. But we kept following the breadcrumbs that she was leaving and finally found her. And when we did, we were able to transition her into an environment that was meeting her needs, was safe. They were actually taking her Social Security payments and processing them whatever way they saw fit. And the resident had no access to her private funds. They were holding her identification hostage as well. So she didn't have her Maryland ID card. She didn't have her Social Security card. She didn't have her Medicare card. She could do nothing independent unless they allowed
oh
it.
my goodness.
So that was
And
definitely a
that's why we call it
hardship.
human trafficking. The parallels, yes, the parallels between this, I mean, when people think about human trafficking, I mean, my assumption is that they're not thinking about people who might be in assisted living or people who are older. They're thinking about, teenagers, or, young people, or people who might be entering this country and they're sort of being held hostage as workers. But it's not just that, because Social Security, if you're getting that check every month, that could be lucrative to a criminal. It may not be enough for the
Absolutely.
actual recipient to live on, but for the criminal, it's like, wow, I can go shopping. I can go to the casino. I can live the life I'm supposed to be living, uh, instead of taking care of this person. Uh,
Absolutely.
but this is just devastating. So
Absolutely.
that's why we
Absolutely.
also need to focus on what can be done. And yeah, and what can be done about this? What kinds of steps what kinds of steps is BC Rest taking, and what can we do about this? And who can we report these heinous incidents to?
Yes, that is so true. All throughout the 50 states, you do have Adult Protective Services, which is called APS for short. They are tasked with addressing community vulnerable adults and making sure that their safety is well taken care of. They do have a direct dial number, which is 1 800 91 prevent, and you can call them, and at any time you can make an anonymous phone call. You don't even have to have all of the details. All you know is that you've seen something, you've heard something, you know something is really maybe putting someone in a unsafe situation. So you can call them to do a level of investigation. If the individual is in a long term care setting, you can always contact the Ombudsman's Program, which is an advocacy program for residents that live in nursing homes and assisted living. There's a statewide office, and then there are local offices as well. Um,
Mhm.
if there are criminal pieces that are happening, we should always be trying to get law enforcement involved, which then by default can bring in a legal arm. The state's attorney's office can look at prosecution and restitution of some of these offenses. There have been a couple of cases within the last 5 years that Maryland state attorney have actually prosecuted some of these individuals, and they are serving jail time right now for this human trafficking of benefits and services for individuals. There's another unit called the Medicaid Fraud Control Unit, which is MAFUCU for short, and its job
Mhm.
is to ensure that Medicaid benefits are being applied appropriately. A lot of times, the fraudulent behavior is misappropriation of these funds or trying to draw down benefits and services that individuals aren't actually receiving. So that's another entity to use. There is a national human trafficking hotline that's available as well. And the one thing
Mhm.
that we always say to individuals is that if you feel as though someone is taking advantage of your decision making authority or misusing your benefits and services, you can always change maybe some of who you've had in your support system circle. Look at your power of attorney paperwork and see if there is indeed something that you need to change. I can say BCRES is doing its part by hosting a variety of educational events and forums that talk about what is elder abuse, all of the strains, not just the financial piece, but all major strains, and then providing some prevention strategies as we're talking about who can you reach out to, but some of those prevention strategies may also keep you safe in terms of safeguarding your information and who is in your inner circle as well. BCRES is a free entity, and we would love to come out and do a speaking engagement and educational series with anybody who's interested in contacting us.
Oh, that's great news, and that is such a valuable public service. And let me just mention some of these numbers again that you so helpfully mentioned. 1-800-91-PREVENT is a number that you can call to report abuse, and that's on your screen right now. 1-800-91-PREVENT. If you look up Baltimore County, Maryland.gov, departments, aging ombudsman, then you can find the information that our awesome guests just referenced with regard to that. And that is also on your screen. And let me also just mention that aarp.org/MD is our landing site for all things Protect Week. And we will find this interview. So if you didn't see it today, and you really should, but if you didn't, you can catch it another time. Whenever it's convenient for you, you can catch all of our social media interviews with all of our experts. You can catch our teletown hall that is coming up on Thursday, the recording of that. You can see the kickoff press conference, and also just resources from all of our partner agencies, like the comptroller, like the Department of Aging, like the Department of Human Resources, we are collecting all of that information so that all of us can feel empowered to do something about this. And I know that even in like even in what am I trying to say, sort of a benign situation, a person who is being taken care of can still feel really vulnerable. And
Absolutely.
they may feel like that the person who's taking care of them isn't necessarily doing everything. And that can happen in family situations too. Even if there isn't anything nefarious going on, it can sometimes feel that
Absolutely.
way. So, what you can do is, I guess what we're trying to get across is that even if we feel powerless, we really aren't powerless. We can dial a phone number, we can talk to somebody else. And if we don't feel right, we need to honor that this doesn't feel right and that
Absolutely.
we need to do something about it.
I think in closing, I wanted to also share that the state of Maryland is definitely taking a closer look, along with many advocacy groups that we've mentioned today. And there was a Senate bill introduced last year, 797, introduced by Senators
Oh, this
Hedelman
year. It
and
was this
Jennings. Oh, this
year,
year.
actually.
Okay. Okay. And that was to introduce a task
Yes.
force on
Yes, it was this
preventing.
year.
Okay, okay. And that was to introduce a task force on preventing and countering elder abuse. So the state of Maryland definitely has their eye on making the changes and providing some safe environments and some strategic alliances that comes across between aging, human services, groups such as AARP, law enforcement, all coming to the table, legal services, to try to address how indeed to keep elders safe and to keep minimizing the impact that elder abuse potentially could have.
Yeah, I'm so glad you brought that up, Lynn. I'm proud to say that AARP Maryland testified in favor of the task force legislation. We think it's definitely something that's needed. The task force will become effective July 1st. So at that point, the governor can appoint the people who are going to serve on the task force, in addition to those who are designated in the statute. It's Senate Bill 797 or House Bill 1191, if you want to look it up. And the task force will be in effect for 2 years. And they're going to be looking into all kinds of things related to elder abuse, because as it turns out, there's so much we don't know.
Absolutely. You're absolutely correct.
Well, with that, I am going to thank our guest, Lynn McCamie. Thank you so much from BC Rest, from providing your expertise on this heartrending but so important issue about human trafficking of older adults when caring hurts. People caring about you, sometimes it goes wrong. And when that happens, if it happens, we need to take steps to do about it. The state needs to take steps, families need to take steps, and the people who are being victimized can take steps. So there are things that can be done. There are places for us to get help. So I'm so happy to be able to say that and to have you kind of shine a spotlight on this issue. Thank you, Lynn McCamie.
Quite welcome. Thank you for having me. It was a great show.
Thank you. And again, aarp.org/MD for All Things Protect Week. And with that, we are out. Take care.